Good morning, good afternoon, good evening. My name is Karina Paz, and today we're going to be discussing cerebral palsy and multiple sclerosis. Now, cerebral palsy, in order to define the term, let's go ahead and break it up. Cerebral having to do with the brain, and palsy as in weakness or problem of the muscles. Cerebral palsy is a group of various disorders that affect an individual's ability to move, to balance, and to maintain their posture. Now, how often does this occur? According to the estimates from the CDC's Autism and ADDM network, about 1 in every 323 children has been identified with CP. It is more common in boys than it is in girls. Now, in order for us to discuss the incidence and the prevalence, it's important to understand the distinctions between the two. Prevalence has to do with the proportion of persons who have a condition at a certain particular time, where incidence refers to the portion or rate of people who develop the condition during a particular time. Now, the cumulative incidence rate at the age of 5 to 7 years was 2.7 cases of cerebral palsy for 1,000 births. Similarly, population-based studies from around the world report prevalence estimates of CP ranging from 1.5 to more than 4 per 1,000 live births or children of defined age range. What causes cerebral palsy? It's actually caused by abnormal development of the brain or damage to the developing brain. The damage can occur before, during, or after birth. As a result of the brain damage during brain development, a child's muscle control, muscle coordination, muscle tone, reflex, posture, and balance can be affected. It can also impact a child's fine motor skills, gross motor skills, and oral motor functioning. So let's go ahead and discuss the characteristics. First, we have physical. We see an abnormal muscle tone, unusual posture, persistent infant reflexes, and early development of hand preference. Second, we have psychosocial. Individuals may develop emotional issues when daily challenges arise. Most common reasons children with cerebral palsy are more prone to emotional difficulties is due to the brain damage. When brain damage occurs, pathways and networks that help regulate emotions may be disrupted. And third, cognitive. We see delayed language development, difficulty focusing on tasks, short attention span, difficulty learning to read and count, issues with sensory stimulation, and emotional imbalances, including abnormal anger, anxiety, and depression. Now let's go ahead and talk about the different types of cerebral palsy. There are 4 different. We have spastic, athetoid, ataxic, and a mixed type. For the first one, spastic CP is caused by damage to the brain's motor cortex, which controls voluntary movement. The second type, athetoid, is caused by damage to the brain's basal ganglia and/or cerebellum. The basal ganglia is responsible for regulating voluntary motor function and eye movement, while the cerebellum controls balance and coordination. Now we have ataxic. Ataxic cerebral palsy is different than the other types because it is primarily caused by damage to the cerebellum, which controls balance and coordination. People with this type of CP often experience tremors and a reduction in muscle tone. And lastly, we have mixed, which is a combination of 2 or more types of cerebral palsy. Now let's talk about exercise. We must pay attention to 3 different components. Muscle fitness, which is both strength and endurance, such as lifting a heavy object and sustaining an activity. Cardiorespiratory fitness, which allows you to participate in physical activity over a long period of time. Flexibility or joint range of motion, which is an integral part of efficient movement and injury prevention. The American College of Sports Medicine recommends that adults do at least 150 minutes per week of moderate intensity cardiorespiratory exercise and muscle strengthening at least 2 days per week. There is no evidence to suggest that these requirements should be any different for people with cerebral palsy. So go ahead and get moving. Although, be wary and be careful. 1. Individuals with cerebral palsy should not participate in physical activities or sport if they're experiencing uncontrolled epilepsy. And 2, they should not participate in physical activities or sports if individuals have severe osteoporosis. Now that you've learned about cerebral palsy, let's talk about multiple sclerosis. What is it? So multiple sclerosis, also known as MS, is a potentially disabling disease of the brain and the spinal cord, so your central nervous system. In MS, the immune system attacks the protective sheath that covers nerve fibers and causes communication problems between your brain and the rest of your body. Eventually, the disease can cause permanent damage or deterioration of the nerves. Now, incidence. The overall incidence rate of MS was 3.6 cases per 1,000 persons a year in women and 2.0 in men. Higher latitude was associated with higher MS incidence, though this latitude gradient was attenuated after the 1980s, apparently due to increased incidence of MS in lower altitudes. The female-to-male ratio in MS incidence increases over time from an estimated 1.4 in 1955 to 2.3 in 2000 when this study was performed. Now the prevalence. A total of 2.8 million people are estimated to live with MS worldwide. MS prevalence has increased in every world region since 2013, but gaps in prevalence estimates persist. The pool incidence rate across 75 reporting countries is 2.1 per 100,000 persons per year, and the mean age of diagnosis is 32 years of age. Females are twice as likely to live with MS than males. Now, what in the world causes multiple sclerosis? Again, MS is a chronic inflammatory disease of the central nervous system, but the cause of MS is unknown. A combination of genetics and environmental factors appears to be responsible. However, there's not enough research that supports that claim. Hopefully, that will change in the near future. Now, let's discuss the different characteristics of MS. The most common characteristic is numbness or weakness in one or more limbs, and it typically occurs on one side of the body, such as the legs or the trunk. Others may experience electrical shock sensation that occur with certain neck movements, especially bending the neck forward, as well as tremors and a lack of coordination or unsteady gait. Vision problems are also common, including partial or complete loss of vision, usually in one eye at a time, often with pain during movement, as well as prolonged double vision and blurry vision. Other symptoms include slurred speech, fatigue, dizziness, tingling or pain in parts of your body, problem with sexual, bowel, and bladder functions as well. Now here we have an illustration of one of the first characteristics that we discussed. So someone that suffered a lesion at this part of their spinal cord experiences numbness, tingling, and pain in the region below the lesion, as we see here. We also see a normal nerve, which is covered by healthy myelin sheath, and then we have a nerve affected by MS. We see the nerve is exposed and it has damaged myelin sheath around it. Now let's go ahead and discuss the different classifications of MS. We have 4 different types. The first, clinically isolated syndrome, is a single episode of neurological symptoms that last 24 hours or more. The second is relapsing remitting, which is actually the most common. 85% of people with MS have this type. It is defined by relapses or flare-ups that result in episodes of intense worsening of neurological function, as well as partial or complete remission or recovery periods after the relapses, between attacks when disease stops progressing, and mild to severe symptoms, as well as relapses and remissions that last for days or months. The third classification is primary progressive MS. 15% of people with MS have this type. This form of MS progresses slowly yet steadily from the time of its onset. Symptoms stay at the same level of intensity without decreasing, and there are no remission periods. In essence, patients with this type of MS experience a fairly continuous worsening of their condition. And lastly, secondary progressive MS. Initially, it may involve a period of relapsing and remitting activity with symptom flare-ups followed by recovery. We all know that exercise is beneficial, but it's especially beneficial to those living with MS. Here we have a few reasons why it does benefit. Among these reasons, we see improved endurance, improved strength, better flexibility, better balance, and you can even heighten your mood. Now that you know that you can get moving, How often should you do it? At least 2 times per week, please, in a low to moderate intensity, which is best. Now here on the right side, we have a chart that breaks down the type of exercises that someone with MS can do depending on how severe their symptoms are. So go ahead and pause the video and take a look. Now, please remember to be careful and avoid exercise that is too aggressive because it can cause severe fatigue, it can bring about injuries, and it can make symptoms worse. If you're interested in researching more about cerebral palsy or MS, you can go ahead and click on any of the references used for this video. Have a great day.